Our presentation is about the transfer of questionnaires from paper to online during the pandemic, and this was to enable us to continue collecting participant data within live studies. So a little bit of background. Keele CTU takes care of the operational management of research studies, and most but not all of these are projects that are associated with musculoskeletal conditions of the older population. This generally means that historically the CTU has used paper questionnaires, and our experience of the use of online questionnaires is a little limited. Our administrators would process participants within a database, and follow-up questionnaires would be manually placed into envelopes and posted out to the participants using mail providers. We recognise that this can be costly to both print and mail out. However, this method has been retained as the evidence of successful online completion for the older population is pretty minimal. Once in lockdown, we had to come up with a way to maintain follow-up of these recruited participants. And of course, all staff were working from home, which meant that mail-outs could not be physically processed or received. Printing services were soon unavailable, and mail postal services were also very limited. And this is where we then quickly jumped onto Keele's software tool called Keele Health Survey. So what is Keele Health Survey? So it's an advanced online questionnaire development tool, and it's underpinned by a free and open source web application called Lime Survey. It provides a platform for online data capture. And in essence, a web link is generated, and this is then provided to the participants for direct completion. These online questionnaires can be open, which means anyone with the link can complete, or closed, which requires the participant to have a token ID, a bit like a password, to be able to complete the questionnaire. The software allows for simple ways to extract data, both for exports of response data and for administrative exports such as data dictionaries or logic survey files. And in terms of data security, the data is held locally on Keele premises and is compliant with GDPR. So to highlight the timeline and progress that was made, remembering that this is for participants who are already consented into the studies, and this was therefore focusing on the follow-up stages to make sure that we could retain this data and capture it as per protocol. Here's what's happened. In March, we initiated training in Keele Health Survey, and in the period of April to June, we managed to get 16 questionnaire booklets converted from paper to online and activated for the 4 live studies. It's also worth highlighting that alongside these designers, there was a specific task and finish group formed, and they were responsible for the management, review and standardizations of processes that were required. And a few further summary points to pick up, as mentioned earlier, across the 4 studies, a total of 16 booklets ranging between 7 and 21 pages were converted, and that equates to about 222 pages of A4. And a brief comparison of time that taken to complete, when looking at, for study A as an example, 20-page questionnaire, postally participants are advised it would take about 30 minutes to complete. And when we reviewed the actual online submissions, on average it took 23 minutes to complete, which might suggest it's quicker and therefore perhaps a bit easier to complete online. So to give a view of what it actually looks like, we've got some screenshots here. So this is an example of a landing page, and participants are emailed the web link along with their token ID to log on to the questionnaire. And on clicking on the link and entering their token ID, they're introduced to this welcome page, and they just click next at the bottom to continue. And this is an example of some simple demographic details, and the participant can easily provide this and certain variables can be set to mandatory, as you can see here on question 2 with the asterisks. Another example is a single choice question, which can be easily designed, whether it's a 0 to 10 scale question like this, or a simple radio button selection like this one here. You can embed multi-question, single choice answers in a table format. And again, with the participant providing a simple click, they can provide the answer. Or additionally, an image, you can provide an image for the participant to view, and then they'd select an appropriate response against the particular visual areas shown on the mannequin here. Also, some license holders provide an online version of their validated tool, which can be imported directly into the Keele Health Survey design. And this is quick, easy, and ensures that we conform to the license requirements. In this example, the participant clicks on the scale to the right with either their mouse, or if it's a smartphone or tablet, with their finger, to indicate how they rate their health today. And all of these examples show how quick and easy and efficient both the design and data entry can be using the online method. So finally, once the participant gets to the end and clicks submit, they're presented with this end page to confirm that their submission has been completed. And linked to the submission to facilitate administrative processing, the CTU would then receive an automatic email notification that the particular token ID has been received. So just running through the process that we undertook using Keele Health Survey for the 4 live studies in the CTU. Again, remember that these participants are already in the study, and this is about maintaining our data collection in follow-up. So the CTU administrator would phone the participant to confirm that they're happy to complete follow-up online, and ask at that point for their email address, because this hadn't previously been collected. The administrator would then email the Keele Health Survey link to the participant with a token ID. And if the participant preferred, we did offer our CTU administrators to complete it over the phone. If no response was submitted over a 2-week period, reminder calls or emails would then be carried out. And if further weeks passed and no response had been received, an option of a much shorter questionnaire that we call minimum data was then offered by the phone or online. So looking briefly at the response rates, this shows here this table. We've got study A, B and C, and you can see the age ranges of each of the studies. A was 45 and over, B 18 and over, and C 65 and over. So not all studies had the same follow-up time points, but you can see that we've got 3, 6 and 12 months indicated here. And we need to appreciate that even though the participants are aware of the follow-up stages, it's not expected to get 100% response rate. So the points to highlight, looking at the follow-up response rates for all of these studies, they are really good. And especially noting study C, the 65 and overs, this has a very encouraging response rates of 89 and 87%. So the task and finish group also looked closer at the data completeness or missing data. And again, we looked at study C, the 65 and overs. So we compared the pre-COVID-19 paper responses and the post-COVID online responses. And we found that there was higher overall response rate in the online than the paper. And we also found that there was little more missing data in the online version than the paper. It is worth noting that all these online questionnaires were designed with low-level use of validation and logic conditions, such as mandatory questions and appropriate skips and fills. And this was intentional to ensure that the online version mirrored the paper version as closely as possible. And linked to that, if studies were planned for online from the initial study design with the correct built-in validation and logic, you would assume that data completeness would be much better, and it'd certainly be better than that of hard copy paper questionnaires. So again, the task and finish group were interested to gain participant feedback, and overall the feedback was overwhelmingly positive. There was a small number of technical queries, but these were easily resolved with the administrators, and participants described the survey as user-friendly, and the majority were happy to complete it in full. We also looked at pros and cons of online data collection for research studies, and I won't talk through all of these here, but just to highlight, of course, there's the obvious saving around there's no need for printing and postage, and thousands alone could be saved with that when conducting large-scale surveys. In addition to that, there's money and time savings in data entry and data management processes that you can see here. However, bearing in mind that we don't want to exclude those who may not have the means or preference for online, to maximise recruitment and reach the unreachable, we envisage that most studies will want to conduct a blended method of both paper and online data collection. So just to recognise those who've played a part over the last 12 months, we would like to acknowledge the following here on the list. And as the CTU moves forward, we're certainly hopeful that more participant data can be routinely collected in an online format to provide cost, time and further resource efficiencies. So please do get in touch and let us know if you think the CTU can help at all.